Welcome back. Dr. Roy Hall here with Mountain Health Functional Medicine. What I'd like to talk to you right now is about 20th century medicine, the big medical clinics that sprang up in the last century, 1950s, 60s, 70s, 80s, 90s. This is traditional medicine still going on in this country. This is not 21st century medicine, but it's 20th century medicine, and it's developed around acute care. And what's happening is a problem with utilizing acute care medicine today, as our major problems are chronic care. We need chronic care. The World Health Organization says 90% of all illnesses are treated inappropriately at this time. And what I mean by that is 10% of all illnesses are treated appropriately, very well, and that's our emergency care, our acute care, our need for surgeries. But the chronic things, the diabetes, the obesity, the hypertension, the autoimmune issues, hormone issues, World Health Organization says those are treated inappropriately. And what I mean by that is, in today's system, you go to the emergency department with chest pain, you're probably going to see a cardiologist. If he says that's heart disease, you have a narrowing in the artery, you're going to get a stent put in the heart, and that chest pain is going to go away. Putting that chest or that stent in the heart does not cure your heart disease. It just gets rid of that chest pain, that angina for the moment. You still have heart disease. Now, if you had that heart disease and it wasn't life-threatening at that moment, and you went to a primary care doc, and that doc sat down and told you how to change lifestyle, how you eat, he can reverse that heart disease and keep it so that pain doesn't come back and the heart disease goes away. What happens in this society in 20th century medicine is you most likely are going to end up with that cardiologist to have that stent put in, rather than the primary care doc discussing and helping you change your lifestyle. And the problem with this is, for that primary doc to do that, he's going to get paid $25, $45. The cardiologist is going to get paid $1,500. So the money shuffle pushes you towards the more expensive thing. And that's where the World Health Organization says we're treating things inappropriately. There's a cheaper alternative that's a better alternative, where you have disease resolution rather than symptom control. And that's what's happening in traditional care. The other thing happening in traditional care is we have the concept that health is the absence of symptoms. And I mentioned a while ago, or in another video, we know that the adult who works 60, 70 hours a week, high stress states, doesn't exercise, eats fast foods for lunch every day, drinks 3 or 4 cups of coffee in the morning to wake up, and has 2 or 3 drinks at night of alcohol to slow down, even if they're not hurting, even if they're not in pain. Our concept is she must be a healthy person because she's not hurting. That's not health. Or you take the adolescent kid who's having hamburgers and fries every day, 3 or 4 sodas, doesn't exercise, and playing video games all day long. Even though he's not hurting, we know that kid's not healthy. But our concept of health is the absence of symptoms. And we know that's not true. The other thing that happens in our society, or in 20th century medicine, is it's a layered health care that we give to people. What I mean by that is, you have a problem. That problem could be pain, could be high blood pressure. You go to that doctor, and because of time restraints and everything else, you get a pill to treat the symptoms. You go home, you start feeling better, and then another problem comes up, and that problem could be totally unrelated. It could be related to that primary problem you had, or it could be related to the medication you got on that last visit, but you go back because you have a new problem, and again you put on another pill. So now you have 2 problems being treated by 2 pills. You go home, and then eventually you got it. Another problem comes up, either a new problem related to one of the old problems or related to medications, and you go back, and guess what? You get another pill. And so our care becomes layer upon layer upon layer, and we never get back to the root cause. And folks, medications are not the solution to our illnesses. You got to realize, in this world, Americans consume 50% of all prescribed drugs in the whole world. but we only have 5% of the population. And the reason that is we have the pharmaceuticals dictating to us via newspaper, TV ads, ads at the movie theaters, pictures at the doctor's office, that you need this medication. And there's only 2 countries in the world where the pharmaceuticals can market to the individual. That's the United States and New Zealand. So we got this layered health care. We have these pharmaceuticals are making tons of money by telling us we got to be on these medicines. That's 20th century medicine. The other thing that's famous for 20th century medicine is the time restraint. This is an old practice, and it works good in acute care where you got a sore throat, you don't need a long time, or you cut your hand and you just need some stitches. But when you got trouble with diabetes or arthritis or hypertension, or you're depressed, or you're just not feeling good, you're tired, you got to have more time to figure out what's going on there. You got to give that doc time to hear your story, and you relay your story, and then time to figure out a plan to get you better. When you only have a 15-minute visit or shorter, you can't get people well with that. So as limited time, what it does is it promotes sickness. It promotes the idea that you're not going to ever get well, you're going to get your symptoms treated, and you're going to come back in a period of time, 1 month, 3 months, 6 months, a year, and talk about your symptoms real quick, and then get another layer added on by another medication, and you'll come back and we'll do another visit, and it's going to be a short visit, and we're going to add another pill, and that layer and layer and layer keeps on adding up. When you go and look at these newspaper ads, magazine ads about medications, or you see it on TV, ask yourself, do they talk about disease resolution or symptom management, symptom resolution? And it's the latter that you hear on the ads or see in the ads. They don't talk about getting rid of the disease. All they talk about is getting rid of the symptom. And I know as a physician in 20th century medicine, corporate medicine, if you came in with neuropathy, I would put you on some pills for the pain. And then with time, that neuropathy is going to get worse, so I have to go up and give you more pills for that pain. And then I get you on some narcotics or some anti-seizure medicines. And what we end up doing is keep increasing the dose of that medication because your neuropathy is getting worse. I also knew in 20th century medicine or corporate medicine, if you came in with diabetes as an adult, I'd start you on one drug, and the likelihood was over time I was going to add a second drug, third drug, and maybe even a fourth drug to keep your sugars low because we're not addressing the problems. All we're doing is addressing the symptoms. And when you address the symptoms, the illness doesn't go away, it doesn't get better, it keeps manifesting itself because you still have the root cause going on. I tell people functional medicine is like if you got pain in your foot and you're taking aspirin after aspirin because that pain is so bad, the answer is not more aspirin. If that pain in your foot is because you're standing on a tack, the answer is get off the tack and the pain will go away. You treat the root cause, the problem goes away. So practice 21st century medicine, root cause resolution versus symptom management. Get out of the big box, come to the micro practice, let us find out what's going on, and let us take care of you.